Kita ra ninyo guys akong kuan screen, maklaro ra? Hello.
Yes, sir.
Yes, sir.
Mo pag luya dira kay ako gali kulang gikog tulog. Naning kamot ko nga magklase karon kay sayang kayo na mo graduate siguro mo no. Simba ko nga wala may matun-an no. Grabe kay nakakulba nga mahitabo no as a student nga wala may matun-an mo graduate. So, this subject is the RT016 and with the title of Radiologic Contrast Examination. Okay? So, in this profession, in our profession, no, kung may muna mo license radtech before, natay ginatawag na mga radiologic contrast examination. No? Other term for radiologic contrast examination is special, no? Grabe special procedure with contrast media. Grabe, no? Grabe ka special kamo guys. No? Naabay gatanaw sa inyo nga special mo nga tao, no? Special mo sa iya. Naaba? Divine, no? Naabay gatawag sa imo nga special ka divine sa kuha. Naaba? Yay naulog is divine no, wala man, di mo tingog.
So, sir?
Wala. Never may hinay signal ni divine no. So, continue ta. So, can you give me one example of radiologic contrast examination or a special procedure? One example, give me one example, no? Daghan kina sila. No?
MRI, sir.
Nope. MRI is a different modality na siya. Okay? Kani special procedure dirita sa general radiology ni siya nabilong. And then in general radiology under the special procedure, when we talk about general radiology, we are using X-ray, no? X-ray machine to treat, not to treat, to diagnose patient. In general radiology, involved dira or under dira ang mga chest PA examination, mga hand X-ray examination, no? And also this one, no? The special procedure. So in special procedure, no, daghan kina sila, no? One of that is barium enema, no? Barium enema special procedure. Common na siya nga special procedure na gina-perform in general radiology nga department. Okay? Familiar mo nga special procedure with the barium enema? Guys? Dili? First time mo makadungog na? Okay? So aside from barium enema, okay? So another example of a special procedure that uses a contrast media. May idea? Any idea, guys? Nope. CT scan is also this is with MRI, no?
Angiography, sir.
Angiography.
Angiography. Okay. Mga esophagogram, mga intravenous urography. Okay, so all siguro dili tanan. So I will do my best to discuss all those types of special procedures na gina-perform, no, in our profession. Okay? So special procedure with contrast media. Okay. So we will perform a special procedure just like barium enema, okay, with the use of contrast media. No, later on we will discuss what is contrast media. Okay, unsa ba ni siya? Unsaon ni paggamit, unsaon ni pag-introduce sa atong patient. Okay? So, discuss nato na tanan. Okay? Okay, murag ang uban diri wala gid mo nagbasa atong reference na akong ihatag. Okay, so dapat no mas maayo bitaw kung ikaw gusto ka makatuon ba kung datagan na ka sa imong teacher o mga reference. So, dapat gamiton to ninyo. Diba, mubasa mo in advance. Maningkamot pug mong inyuha, dili lang kay magsaligda sa teacher, no? Inana ko mentality before, no? Ako mga teacher before, di ka klase, at sinan pa may. So, nauna po, kung magsalig ko sa akong teacher, bawag ko'y matunan. So, sa una, kung wala may klase, magtambay lang kong library, basa-basa kong libro dito, ba? At least man lang, maski wala may kaklasihan, ba na ako'y matunan, dili sayang akong adlaw. Okay? Ano nga mentality ba, di ba? Nitap ko sa board exam no, sa dili pa ginambog. Okay. I tap the board exam, dili tungod sa mga teacher o sa ubang tao. No, nagsalig ka sa ubang tao. Itap ko sa board exam, tungod kay taong pagpaningkamot. Dili ko kanang kanang bitong klase nga tao nga genius. Kas ang discussion, kausang basa, makakuha diretso. Ba? So, ako slow learner gyapon ko, pero akong edge sa uban or advantage na ako sa uban nga kumbaga naa sa ko nga wala sa ubang mga classmate nako or wala sa ubang student nga wala sa ubang mga takers sa board exam is kana akong kakugi, no? Kugihan gyud ko mabasa. Di ko ganahan magansi or maalkansi akong adlaw ako'y matunan. Na ako'y mga classmates sa una, mga grabe, mga genius ba? Kas arang basa, kas ang discussion, kuha nila diretso ang gini-discuss sa ilang mga teacher. Ako dugay ko mag-ex mo na akong kilay, yun sa man way. Hindi ko makasabot. Pero sila, no, magsalig lang sila sa teacher. Tapulan ka sila mabasa. Okay. So, in the board exam, sa pag-board exam, no, mas nitap nun ko atong mga kauban ako sa una or mga classmate ako before nga mga genius. Okay? So, murag taas kaya akong intro, no? Share lang ko para motivate pod mo. Sama sila ay. Muana ra mo, sir. Ikaw giga klase sa mo, sir. Ang uban dili ga dili ga klase ubang teacher na mo. Dili na siya rason, no? Nga di pod mo magbasa or maningkamot. Okay ba? Guys?
Sir, naidi ka sa Bisaya, sir.
Ha?
Naidili ka understand og Bisaya.
Na ba?
Yes, would be, sir.
Parang mapapasubok ako dito magtagalog. Isikuan lang. Si ano lang. Ano yung pangalan nun?
Hindi, sir.
Hindi.
Murag dili sa siya ka understand og Tagalog, sir, kay foreigner man.
English ra, sir. Nigeria.
Okay, so I will try my best to discuss this subject with English language. So actually, I'm not really good in speaking or using English nga language, but just like I said, I will do my best to explain, para masabdan, to understand all the topics that I will be discuss. Okay? So, in this subject, the first topic to be discussed is all about the radiographic contrast media. Okay? So, the aim of this session, guys, is ito yung morning mga topics or mga kumbaga objectives nato. This is our objectives that you need to understand at the end of this session. Okay? So, the aim of this session, guys, why contrast agents are used. Okay? Ngano ba in every special procedures necessary ba siya necessary to inject or use a contrast agents. So I am discuss ko about contrast agents. Can you give me an example of a contrast agents, guys? Any idea of a contrast agent that is used in a radiologic contrast examination or a special procedure? Any Yeah, guys. Gayon na, no? Guys, good ko special procedure. But towards to siya nga towards to siya nga special procedure akong gihatag nga example. Okay? So, ang first nga
Intravenous urography.
okay? Okay, nice try. Okay, so example of a contrast agent is a barium. Okay. So later on we will discuss what are those types of contrast agents that is being used in a special procedure. Okay, later on guys. So ready mo sa inyong mga notes ha. Okay, second one, what are the desirable features of contrast agent? Okay, types of contrast agents used in clinical settings. Okay, so another one, methods of administering contrast agents. So in this topic, no. So when we talk about methods of administering contrast media, how will we inject a contrast agent during special procedure? How will we introduce or administer a contrast agent to our patient? Just like in barium enema, what do you think is the method of administering a contrast agent in a special procedure that is called barium enema? What do you think? Okay. Any idea? What is the method of administering contrast agent? No, just like contrast agent, example dira barium. Ba? Sa paano na to pag-introduce? How will we introduce a barium to our patient in a barium enema examination?
Sir, dili na siya kanang oral.
Nope. Oral is also is one of the method of administering a contrast media. Orally, no? Paiinumin natin yung pasyente with barium contrast agent. But I am talking about a barium enema examination. So, based kung siguro
Rectal,
sir.
Sa fluoroscopy, sir.
Okay. So, same, correct yung kanina, no? May nagsabing orally. One of the method of administering a contrast agent is orally, paiinumin sa pasyente. Another one, rectally, no? Especially in the barium enema special procedure, no? Rectal ang method of introduction or administering a contrast media in that kind of examination. Okay, another one aside from orally, rectally, so any idea another methods of administering a contrast agent?
Through venipuncture, sir.
Venipuncture is not a method of administering
Intravenous, sir.
Intravenous injection, sir.
intravenous. Okay? So when we talk about venipuncture, naman may subject about venipuncture? Ano?
Naa, sir, but online ra.
Online yapon kay. That is so Orag makatawa ko sige kung mag-English kay di ko ganahan gid mag-English pero since nga naamoy classmate dire nga dili ka understand og Bisaya so i-try gid ako akong best. So ma-expect mo nga mura akong my English is so bad but I'll try my best to explain all this subject with that language. Okay? So take note, orally, rectally, intravenous. So if ever another method of administering a contrast media, okay, so tagaan ta mong idea, I will give you a clue, no? If ever our examination is a spine, no, or lumbar angiography. Okay, lumbar angiography special procedure. What do you think? What is the name of the method of administering a contrast agent? No, if the examination is a lumbar angiography, what do you think? So if ever someone can give me the name of that method, I will give a plus points in our face-to-face. Kung saan mong, kung ikaw pili, no? Plus points in P1, P2, RBA. Ikaw po magbuot, no? If ever, pila ka, sige na, plus points imong gusto.
Pwede try sa
Okay, try.
catheter, subcatheter.
No. Later, no? Orally, rectally. Ba? May say oral, the contrast agent is being introduced to the patient, no? Ipaswallow niyo na siya. When we talk about a rectal method of administration of contrast agent, no? Dito ta sa we will inject a contrast agent in the rectum of the patient. Okay?
Sir, epidural?
No? Okay, so nice try, no? Murag taas na kayo ang time. So I will give you the correct answer. The correct answer is intrathecally, no? Intrathecal. Okay? So take note of those methods of administering a contrast agent. Okay, so tatlo yung binigay natin, no? Orally, rectally, and intrathecal method. So another objective of this session is examples of examination utilizing or using a contrast agent. So again, what are those examinations or special procedures that uses or utilizing a contrast agent? Again, what are those example gali? Guys? Sa ito na mga examination, kung ipangatagay na, mga example. Okay? So, daghan kayo na sila. Okay? But, hatag na ako ang some of that examinations. Sa ito, guys.
And geography?
Geography. Baryominema again, no? Esophagogram.
Lumbar.
Lumbar angiography.
Barium esophageal?
Yep, that one. Okay, so so another objective of this session is problems, issues associated with administering a contrast agent. So when we administer or when we give a contrast agent to the patient, there's a lot of problems or issues being encountered, okay, during the procedure. Okay, one of that problems is that when we inject a contrast media through the veins of the patient, after the introduction of the contrast agent, the patient will experience allergic reactions. Okay, so that is one of the most common problem being encountered when we administer a contrast agent to our patient. Okay, so all of that will be discussed at the end of this session. So I hope you will learn after this discussion. Okay, so definition of contrast media. Okay, a contrast media are a diagnostic agents that are instilled into the body orifice or injected into vascular system, joints, and ducts to enhance subject contrast in anatomic areas where there is a low subject contrast. So, a contrast media daw ko, no, guys. Okay, this is a chemical or diagnostic agents, no? Kanang mga barium, mga water-soluble iodinated contrast media, no? Those are the examples of a contrast media. Okay, so that are instilled into the body orifice. So, what are those examples of a body orifice in our body? Okay, sir.
Mouth.
Mouth. Okay. Another one. Okay? In a barium enema,
Tom.
what do you the rectum or
Rectum.
anal. So that orifice is, that smells so bad. So okay, so in a barium enema, we will introduce again the contrast media to anal orifice or our patients with, no, based in my experience, uh, we, when I, kung mo inject ko og contrast sa akong pasyente, guys, okay, some of the patients nga nag-undergo of this, in the barium enema examination, napay mga mga tai sa ilang hubot, and then may encounter gid nga baho siya, or but if ever sige na nimo buhaton kay murag maanad na ka ba, no? Or di na ka sige na ludan, okay, sa baho sa imong pasyente, kaya wala man kay choice, no? As a rad tech, you need to perform that examination no matter, no, kung sa imong patient, no, baho ba siya or toxic na mga patient. Okay, so maanad ra ka ani na mga examination. Okay, so another one, or injected into a vascular system, or when we talk about vascular system, it talks about veins, arteries, no, or any blood vessels into our body. Okay. Another one, we will instill or inject also a contrast media to a joints. Okay, maybe if ever the examination is knee angiography, so the contrast media is directly introduced or administered in a knee joint, okay, and ducts to enhance subject contrast in anatomic areas where there is a low subject contrast. Okay, do you have any idea, guys, no, what is low subject contrast, or ano na lang, okay? Can you give me a body part, okay, which is a low subject contrast? Okay, any idea? When we talk about a low subject contrast, no, those tissues, if ever the X-ray interact to these tissues, no, that tissues absorb less radiation. Kumbaga, the radiation is easily penetrate when the X-ray interact in these types of tissues. Okay, those are the definitions of a low subject contrast. Again, when we talk about low subject contrast, those tissues in our body, no, with when the X-ray interact to that tissues, no, that tissues will absorb less radiation, or the X-ray easily penetrate to that types of tissues. So what do you think those tissues kaya, guys, nga low subject contrast? No, I just give you the hint, the idea, no, about this low subject contrast. No, so I am asking for what are those types of tissues kaya that are very low subject contrast?
Muscle tissue, sir.
Okay, muscle tissues, okay, is a good example. Okay, another example, guys. What do you think? Oh, 'di ba? Kung tanaw ako noon, matanaw ba? Okay? So hilam-hilam magoro na inyong mga kalawasan dira, guys. Kung kung sa inyong mahilam dira, no, kung yung kamot niyo mahilam, no, low subject contrast kaya ni nga tissues, no, is this type, or is the tissues in my forearm is a type of is a low subject contrast tissues? What do you think? Okay, so try, no? Dapat mo try mo, guys, even though siguro mamali mo, ayaw mo ka, sige na, ayaw mo kaulaw nga masayop. Okay.
Sir, adipose tissue, sir. Kanang fats.
So adipose tissues. Oh, yeah. Diba? Adipose tissues sa mga tutoy. Diba? Nang duha ka ano ninyo dira. Okay? Those are adipose tissues ng mga boobs. Okay? So, if ever ang X-ray mo interact to the boobs, to the breast, to your breast, okay? So, the X-ray will penetrate easily, or the breast tissues will absorb less radiation. Okay? So, if ever, no, what will happen if the breast absorb less radiation? No? What will be the appearance in the radiographic image of the breast when again, no? If the breast absorb less radiation and the X-ray penetrate to the breast easily and then interact to the image receptor, what do you think is the appearance of a breast in a radiographic image, guys? What do you think? Is it a radio opaque, radiolucent? Okay. What do you think? Radiolucent. Okay. Very good. So, if ever those tissues with low subject contrast is like mga adipose tissues, mga breast, or any soft tissues inside our body, no? Thyroid, sa pa may mga soft tissues, buttocks, okay? So those are soft tissues. The abdominal organs, okay? Can you give me example of abdominal organ? Okay? Unsay naa sa atong abdomen guys? Unsay naa ng mga organs dira?
Liver, sir.
Intestine, sir.
Intestine, liver, stomach. Gaik ko kasi gaik. Paki-mute dayon dito pag umanogan sir. Gaik ko. Okay, so those are tissues with a low subject contrast. Kumbaga, if yung appearance in the radiographic image, mostly they are radiolucent. Okay, we cannot kumbaga, okay, I will give you an example of image where the abdominal organs cannot dili kay nato siya makita ba. We cannot see those type of tissues in an X-ray image or a radiographic image, no? Those atong mga stomach, intestine. Okay? So, na ako example dito dire. Dalan ta mo. Okay? So, kita ninyo guys, no? So, this is an X-ray of the abdomen where in the abdomen we will expect that naadira ang liver, mga stomach, intestine, okay, without giving a contrast media to the patient, dili kay siya makita, no? We cannot see clearly, no? Which one here is the liver, which one here is the intestines, no? Which one here is stomach. Okay. Can you see in this image? This image is arm imagination. Introduced in the pins are high. Diba? Look at the difference between these two images. Okay? This image without contrast media. No, we cannot see clearly or visualize a large intestines. Okay? But with the contrast media, with the introduction of the contrast media, no? The descending colon, the transverse colon, the ascending colon is clearly visualized. So if there is pathology, no, any pathology or abnormalities in the large intestine, no, the doctor can diagnose no, if ever there is abnormalities in the large intestine. Okay, so if we can, the doctor can easily diagnose if there is any pathology of the large intestine if we are using a contrast media. So, no, that is the importance of introduction or using a contrast media, no, in radiologic examination or mga special procedures. Okay. Again, what is the reason? Why is it that in this image, what is the reason? Why is it in this image the colons or the large intestines are not clearly visualized? What do you think is the reason? Okay. Because
The
a
contrast
large
media, sir, is not in.
intestine. Oh yeah. Okay. Okay. So the reason because the large intestine is a low subject contrast. Okay, low subject contrast tissue siya. That's why in this image, okay, the large intestines are not visualized. But by the use of the contrast media, which is a contrast media, is a high subject contrast na siya. No, kumbaga, when we talk about high subject contrast, okay, ito itimanin ninyo guys, no? If ever a subject or an object is a high subject contrast siya, meaning the X-ray cannot easily penetrate, no? Or that tissues or just like kanino si contrast media or this object the contrast media. Okay? So if ever the X-ray will interact to this area, okay? So the X-ray here is being absorbed, no? Walang makaka-penetrate na X-ray. So walang makakapunta sa yung image receptor. That's why, no, in this image, no, the appearance of this area is radio opaque, no? Because again, the X-ray, no, being absorbed in this area, unlike this one, no, in this area guys na walang no, there's no contrast media. This area, no, the black part of this image, no. If ever the X-ray interact to this area, no, in this area there's no contrast media. So if ever there's no contrast media in this area, the X-ray easily penetrate, no. The X-ray here is not being absorbed, no, and then penetrate and then interact to the image receptor. That's why in this image, in this radiographic image, the appearance in this area is irradiolucent. Okay? So again, timala lang ninyo dira guys, if ever those tissues with a low subject contrast, low subject contrast, no, just like again, esophagus or any abdominal organs, no, liver, stomach, intestines, colons, okay, those example of tissues, those type of tissues, they are a low subject contrast. And then lagi na atong timan-an dira guys, that if ever a tissues which is low subject contrast absorb more absorption of X-ray or less absorption of X-ray. If ever the tissues is low subject contrast, more
Less.
absorption
Less.
of X-ray or
Less
less?
absorption, sir.
Less.
Lesser.
X-ray will penetrate easily or less penetrating the X-ray? Less penetrating ang X-ray if ever may interaction sa low subject contrast ng mga tissues. Less penetrating or more penetrating ang X-ray?
More penetrating.
More, sir.
More penetrating, sir.
If ever,
More.
no? X-ray and the interact to low subject contrast tissues and then easily penetrate, what will be the appearance in the radiographic image? Is it radiolucent or radio-opaque?
Radiolucent.
Radiolucent. Okay, very good. Okay? The same with the high subject contrast na mga high subject contrast na mga structure or mga object, just like a contrast media, no? A contrast media is a high subject contrast na siya. Okay? So, another example, can you give me another example? A tissues inside our body which is a high subject contrast siya. Kumbaga, in every image, expected ka nga radio opaque yung appearance niya. What do you think?
Bones.
Bone.
Bones. Very
Bones,
good.
sir.
So, itatag bones nga image diri, guys. Unta mo basin niya, grabe si sir, no? Basin niya ga buot-buot lang ko ba? Unta mo kuan kanang evidence, no? So, this is the spine, di ba? Okay, so a spine is a bone. Okay? Again, bone just like we are talking about, no, that bones is high subject contrast. So if ever a tissues, just like a bone tissues, which is high subject contrast object again, they can absorb more absorption of X-ray if ever the X-ray will interact with the spine, no? So less X-ray will penetrate. So in the radiographic image, no, this is the radiographic image, guys. The appearance of the bones are radio opaque. Okay, more na intimanan, no? Just always remember the concept of a low subject contrast, a low subject contrast objects and the high subject contrast ng mga object. So, what do you think, no? The reason, no? Siguro na mo'y idea karon that a contrast media is introduced to the patient, no? So that the tissues with a low subject contrast of tissues siya or high subject contrast. So, ano na lang, no? Complicated yung sige na, akong question. So, a contrast media is being introduced to the patients. Okay? This is to visualize a low subject contrast tissues or a high subject contrast tissues.
Low.
Okay, what do you think, guys, no?
Low
So,
subject contrast tissues.
Okay? So, again, no? Kita na ninyo yung importance of using a contrast media. Okay? Because we will use a contrast media to highlight or to visualize those tissues with a low subject contrast. You know, just like again, balik na ko again, in this image, no? A contrast media gi-introduce na to directly to the large intestine. Again, the large intestine, a low subject contrast na tissue siya. So after that, we na-visualize na we are clearly visualize a large intestine. Unlike with this image without contrast media, those tissues with a low subject contrast cannot clearly visualize. The bones, kaning bones diri, kaning sa atong pelvis, sa atong spine, dili na ta mag-introduce og contrast media. Okay, naman, without contrast media, they are clearly visualized naman. Kung pangutanon mo ba, if someone asks you about a contrast media, okay, what's the importance of contrast media? You just tissues with a low subject contrast. O lang. Okay? So those tissues with a high subject contrast is like bone. No? We will not introduce a contrast media, no? Kumbaga useless na. Okay, so we will continue, no? So this this description pa lang, no? The first definition pa lang of a contrast media, no? Daghan na kay tag na sige na discuss, no? So next definition, if a contrast media, a material that is being ingested or injected into the body for visualization of organs. Okay? Ingest, okay, when we talk about ingestion, we will give a contrast media not through the oral, no? Orally. Swallow na sa patient. Okay? Injected into the or which are not visualized in a plain radiography. Okay? So a contrast media daw kuno is a substance having either a higher or lower atomic number. Okay? So can you give me an agents or any tissues, no? Which is higher in atomic number? No, kung contrast media inyong mahatag nga example sa kuha, no, much better, no? Higher atomic number contrast media, or kumbaga higher atomic number nga tissues na lang, no? You don't have any idea about a contrast media, types of contrast media which is higher in atomic number, okay? No, tissues na lang. Okay, so any idea, guys? No? Tissues or a contrast media which is a higher in atomic number. Okay.
Iodine, sir.
Iodine. Okay, very good. Okay. So iodine is an element or a substance which is a higher in atomic number. Okay. Always remember, guys, if ever any tissues, any substance, any object, no, if the X-ray interact to that, ano, object, to that tissues, ano, contrast media, no, mas bari
Excuse me, sir.
yung
Choppy ka, sir.
iodine, no, the X-ray will absorb.
Excuse me, sir.
Sabi ko, my God, galisod gigog gamit og ing guys. Pero okay ra ba? Masabtan ra? Okay pa mo dira, guys? Okay, guys. Hello.
Yes,
Copy
sir.
ko?
Sir, choppy ka, sir.
Copy,
Kira man sir,
sir.
pero putol-putol.
Okay, wait lang. Ha? Morning disadvantage, no? Sa online discussion, no? The internet connection. Okay, nang I will suggest that sa atong face-to-face discussion, you should tawagan na. You should attend those face-to-face discussion. Although wala pa tayo concrete na dates or exact dates for our face-to-face, but dapat wala mo reason nga di mo maka-attend, no? Ay sayang. Like karon, no, putol atong discussion. So okay na ha. Anyway, naka-record man pud ni. Naka-record ba? Yeah, naka-record siya. Uy, dagan-dagan mo rin ta diri, no? 73 students. Pang-close. Ay, naku, anong internet sa Pilipinas? Hinay kayo. Okay, so maklaro ra ko? Hello?
Yes, sir.
Ra?
Okay na, sir.
Okay, so continue ta, no? So again, if ever any substance, just like a contrast media, okay, if ever a high in atomic number, okay, the X-ray will absorb, and then the X-ray cannot penetrate easily. So that's why all objects with a high atomic number, just like the bones is also a high in atomic number. That's why in the image, they appear as a radio opaque or white in appearance. Okay? So, i-contrast media daw ko, no? Lower atomic can be a lower atomic number than the surrounding tissues. Okay? Substance, a contrast media is a substance having a lower atomic number than surrounding tissues. So, can you give me a substance or a tissues with a lower atomic number? Yeah, except with the examples that I given, no, while ago, no. Can you give me another example of a substance inside our body? Okay, that is a lower atomic number. What do you think? Kaya unsay nasa lungs?
Air.
What is in lungs? Ha?
Oxygen.
Okay,
Air.
oxygen.
Air.
Air.
Oxygen.
Okay, very good. So, nitrogen or any gaseous elements inside our body, no? Nitrogen, carbon dioxide, air, oxygen. Okay? So, they are a low atomic number. So, a oxygen, carbon dioxide, nitrogen, no? They are also considered a contrast media also, no? Okay? Pwede ta mag-introduce og air, a carbon dioxide to our patient. Okay? As a contrast media. Okay? So later on, no, I will give you a different examination that uses a low atomic contrast media, no, or kumbaga we will introduce a gaseous material to our patient as our contrast media. And always remember that all substance inside our body, no, which is low in atomic number, just like the air in the lungs, okay, they appear a black or radiolucent in a radiograph. Okay. Okay, so which are used to represent organs of the body which are not visualized in the plain radiography. Okay. Okay, so we will discuss about a subject contrast. So, are you familiar with a subject contrast, guys? Or first time nyo maka-encounter with this topic? No? Diba? Third year na mo. Niya. Kumbaga, first time ba ninyo ma-encounter ni na mga, ano ba, na topic? Grabe, no? Alkansi kayo. Okay? So, when we talk about subject contrast, a range of differences in the intensity of the X-ray beam after it has been attenuated by the subject or atong subject, atong patient. Okay? So, when we talk about subject contrast, again, range of differences daw in the intensity. When we talk, another name for the intensity is the number, no? In the number of X-ray after it has been attenuated by the subject. Okay, so what is attenuation? Now, before we will proceed, or I will explain this, this description here. No, what is attenuation? By the way, who can describe attenuation?
Quad, sir.
Reduction.
Reduction in intensity
Intensity
of X-ray
of X-ray. Okay. Attenuation, the definition of the attenuation is the reduction of the X-ray beam after after the interaction to the patient. Kumbaga X-ray ba? X-ray mo interact sa kuha. So some of the X-ray will be absorbed. Okay? Some X-ray will what? Mo penetrate. Kumbaga, kaya ano na lang, no? Basta sakto tong definitions, no? Na gihatag ninyo sa kuha. When we talk about attenuation is the reduction of the X-ray beam after the X-ray interact to the patient. No, nganong ma-reduce man ang number of X-ray or the intensity of the X-ray beam after ni interact ang X-ray to the patient because the X-ray some of the X-ray is being absorbed by the who will absorb the X-ray? The patient. That is the reason, no? Nganong na reduction of intensity. Okay? So, range of differences. So, different tissues, no? Different subject contrast. Di ba? Natay ginatawag nga low subject contrast tissues, natay ginatawag nga high subject contrast tissues. Example of low subject contrast tissues again, those are tissues, especially in the abdomen, no? When we talk about high subject contrast tissues, example dira, ang bones. Okay? So, timaan na nato dira, no? All tissues with a characteristic which is high in atomic number, okay? They are called a high subject contrast. Those tissues with a low atomic number, just like abdominal tissues, air in the lungs, they are considered as low subject contrast. So, high subject contrast tissues absorb more X-ray. Low subject contrast tissues, always remember that it absorb less X-ray. Okay, nakuha guys? Okay, timan ilan inyo na concept. Okay, for low contrast structures or tissues, what can be done to attain medical information? See the difference between muscle, organ, or vessels. Define that. Okay, wala na ni. Okay, so in a radiograph, in the image, okay, how we can clearly visualize a tissues which is a low subject contrast, gali? How? By what?
Administering contrast.
By administering a contrast media, no, to the tissues. Okay? It's like in barium enema. In barium enema, what is the mode of administration again of that examination?
Rectal.
Modes of administration, ha?
Rectal.
Rectally. Okay? In upper GI series, what do you think is the mode of administration?
Oral.
Oral. Okay? Very good. Okay? So, contrast media is used to enhance subject contrast or render high subject contrast in tissues that are normally as low subject contrast, no? Contrast media daw, no? Word by word, I will explain this description here or the definition of a contrast media used to enhance subject contrast or render a high subject contrast, okay, in tissues that are normally has a low subject contrast. Para mo enhance, no? With the use of contrast media, mo enhance daw. The low subject contrast will enhance. That is the importance of the importance of using a contrast media. Okay? So, we will proceed to the types of contrast media. Okay? Natay ginatawag nga radio-opaque contrast media. Okay? Mauning duha. First type of contrast media is a radio-opaque contrast media. So, a radio-opaque contrast media appears white. Okay? White or when we talk or decrease in density on a radiograph. Okay, wait. What is the definition of density, gali? The amount of
blackening
in the radiograph. So if ever in the radiograph there is a reduction of density or amount of blackening in the radiograph, so possible or so it appears white, no? Just like this one, no? Ito tag example. Just like this one, no? In this area of this image, there is a reduction of density or the amount of blackening in this area. So it appears white in the image. Unlike with this area, guys, this one, no? There is a higher amount of density or the amount of blackening in this area. So that's why it appears radiolucent. Okay? So example of a contrast media which is a radio opaque. Okay? Example is a barium sulfate substance or iodine. Okay? Muna sila ang mga example if a contrast media which is under a radio opaque. Okay? Also known as a positive contrast media. Okay? Positive contrast media or radio opaque contrast media, no, they are the same. And example of a positive contrast media or a radio opaque contrast media, this one, no, the barium sulfate and iodine. So why is it that a barium sulfate and iodine, they are called or they are an example of a positive contrast media? And if ever we will introduce a barium sulfate and iodine to our patient, it appears a white, no, white appearance. This is the reason because barium sulfate and iodine composed of elements with a high atomic number. Okay, mo nang reason. Kung tanon mo ba kung if ever mag-intern na mo, pangutanon mo sa inyong tech, no, the registered radiologic technologists in the hospital, if mag-intern mo po, no, why is it that a barium, a iodine appears white in the image, no, or a bone, no, in the X-ray image appear white or radio opaque in the image? The reason, the main reason for that, no, this one. Kwan man sir, no, si barium, si iodine o si bone ay atomic number man daw. No, mao man na ingon ni Sir Angelo, no? If ever daw high atomic number ang usa ka substance, isa ka tissues, it always appear white in the radiographic image. Because if ever X-ray interact to the tissues or elements or a substance with a high atomic number, okay, it absorbs less X-ray or it absorbs more X-ray.
more.
Okay. So, can you give me the atomic number of a barium?
56.
56. What is the atomic number of iodine?
53.
What is the atomic number of a lead? Lead. Ligawas sa mong board exam. That
82.
question, huh? 80?
82.
84?
80.
84 ba?
82.
82. No? Gawas sa board exam. Okay. What is the element being used as a target material in the anode of the X-ray tube? What is the element there? Tungsten. What is the atomic number of the tungsten? Okay, grabe pa.
74, sir.
64, sir.
74.
Oh, very good, no? At least na mo yung mga idea, ana, no? That kind of questions are basic, no? Mga basic na siya ng mga topic, ng mga atomic number, no? About density, definition sa density, kanang mga attenuation. Dapat kabalo na mo, ana. You should translate na English. Okay? So, dapat kabalo na. You should know that basic topics in our profession because mga common na sila ng mga pangutana sa board exam. Okay? Kung ipuhon mag-take ng board exam, yun ang maglisod. Okay? So dapat kabalo na mo na. Okay? So another type of contrast media, okay, is radiolucent. So this type of contrast media appears black or increase in density, or when we talk about increased density, higher amount of blackening in the image, okay, or in the radiograph. Okay, radiograph ay mo ka confuse about radiograph, X-ray image, radiographic image, they are the same, no? Kani siya is a radiograph ba, or a X-ray image or radiographic image. Okay, the same na sila og term. So if ever daw radiolucent or appears black in the image, just like in this area, okay. Wait lang. Okay, so examples of a contrast media which is a radiolucent, okay, air in the lungs, that's why in the chest PA, no, chest X-ray nga image or chest radiograph, okay, na may makita dira nga a black or radiolucent part of the image. Okay, inside the lungs, naman dira ang air, ba? Okay, another example here is the nitrogen, carbon dioxide. Okay. Radiolucent contrast media, also known as a negative contrast media. Okay. So it appears black or radiolucent in the radiograph, because the main reason for that, this gas here, the air, nitrogen, carbon dioxide, yung composition niya, they are low in atomic number. Okay. So, 4 physical states of contrast media. Okay. So, first one is the oil. Okay, natay oil na mga contrast media. Okay, example ana is anang mga pantupik, mga Junocell, no, they are oil-based contrast media. This type of contrast media, which is oil-based, is used in myelogram and bronchogram studies, no. So myelogram is a radiographic or a special procedures used to visualize a spine, no, or a spinal cord. Okay. A bronchogram is a radiographic or radiologic examinations or a special procedures used to visualize the bronchi or bronchioles in the lungs. Mga bronchogram. So if ever pangutan-on mo, no, what type of contrast media being used, no, or what physical states of contrast media which is being used in myelogram or bronchogram studies. Okay? So atong i-answer dira, the answer should be the oil-based contrast media. So kaning mga pantupik, Junocell, they are the brand name, no? Mao ni sila na mga type or brand sa contrast media nga oil siya nga kuan. Kumbaga oily siya ba kung pag kuha nimo ani sa contrast sa bottle, no, mostly oil ang imo makita, no, oily ang iyang appearance. Okay, kaning mga pantupik or Junocell. Okay? So if ever karon kanina mga examination, these types of special procedures, kaning myelogram and bronchogram, they are obsolete na mga examination. Kumbaga, dili na kayo gina-perform na mga ano ba, na mga procedures, because karon ang doktor mostly ga request naman og MRI, no, or mga CT scan, no? So rarely na kayo ni sila na mga examination. So kaning mga oil-based na mga contrast media, yung mga pantupik Junocell, wala na kayo ni siya makita ninyo na mga, or dili na ninyo kayo ni mapalit sa pharmacy. Okay? Because again, the reason for that, myelogram and bronchogram is less na kaayo na gina-perform ng mga examination. Because again, to visualize, kumbaga, di ba, myelogram used to visualize a special procedure or the special X-ray examination procedure that use a contrast media to visualize spinal cord, di ba? Muna akong ingon kanina. In the MRI, no, the spinal cord is clearly visualized naman siya. So, di nakita kinahanglan aning myelogram na mga procedure and also a bronchogram, okay, na mga special procedures. Okay, so the second physical stage of contrast media, no, is a tablet. When we talk about physical stage, kung unsa ato makita ba? Pagpalit na to ani na mga contrast media, just like ani pantupik yun sila again, if we unbox, kumbaga, if we unbox a contrast media, no, pagpalit nimo sa contrast media, naka-box man na siya or naka-seal, no? Kita nimo anang contrast media, no? Ang nasa sulod, mostly oil siya, ang yang appearance. No? Muna ipasabot ang physical state. Okay? Kung unsa imo makita or what you can see or the appearance of a contrast media, no, when we buy that in the pharmacy. Another one is a tablets, okay? So, na yung mga tablet ng mga contrast media, just like mga biloctin, mga telepic na mga kani mga ngalan, mga biloctin, telepic, they are brand name of contrast media. Kumbaga mauna sila ang mga manufacturer, no? Muna ang name sa contrast media if ever ang manufacturer is a Bayer, mga Pfizer, kumbaga mga inana ang mga manufacturer ba. Okay? For example, ang manufacturer is a Bayer or Bayer. Okay? So, for example, ang tawag sa ilang contrast media is a biloctin. So, if ever biloctin siya, mostly tablet yang physical appearance. Okay? Sa contrast media. The same with the telepic, kaning mga colibrin, pyrisictan, and cystobil, no? This type of contrast media is used in a gallbladder studies. Okay? So, what do you call a what is the name of a radiologic special procedures, okay, used to visualize a gallbladder? Okay? Unsa may tawag ana ka, guys? Okay, kung barium enema is a radiologic special examination used to visualize a large intestine. Okay, so I am asking about the radiologic term or the name of examination that is used to visualize a gallbladder. Okay, what do you think? Any idea? Gallbladder. Radiologic examination used to visualize a gallbladder. Say, what is the medical term for a gallbladder, gali? Ano guys, napamodira? Kasi nangatulog na mo ha.
Ultrasound,
Are you
sir.
still with me, guys? Ha? What is the medical term for a gallbladder? No, lihis na ko ang question. What is the medical term for a gallbladder, gali? Yay. Di ba na medical term naman mo? First year na, second year. Ang subject nga ano? Medical term. First year, no?
Sir.
Ha? Cholecystitis.
Cystiasis.
Gallbladder. Cholecystitis is a medical term for a gallbladder stone. Okay? Kung gallbladder lang, cholecysto. No? So, radiographic examination used to visualize a gallbladder is a cholecystography. Cholecysto is a medical term for a gallbladder. Graphy meaning to visualize or to graphy. Basta to visualize. Okay. So, if ever, pangutanon mo, if ever the question is, what is the physical? Okay, pakimute please. I-mute inyong microphone. Thank you. Okay, if ever in the exam, there is a question there that what is the physical states or physical appearance of a contrast media that is being used for the gallbladder studies? Okay, atong answer dira is the tablets. Okay, for myelogram, bronchogram, what is the physical states of contrast media? Okay, oil. Okay, is the oil base. Okay, so another physical states of a contrast media, natay powder. Okay, powder, murag gatas ba? Pakiton ta mo ha. May contrast diri guys. Nga powder siya. Actually, na ako sa hospital karon, no? I'm here in the hospital. English na ako para makasabot ng Nigerian. Okay, so what is the name of our foreigner classmate ninyo guys? Gali? So,
Ude, sir.
Ha?
Ude,
Okay,
Daniel.
okay. So, Miss Ude, if you have any clarification, questions, no, you can privately message me in the messenger. Okay. If you have questions, I will answer that. Okay. Any clarification, if you don't understand about this topic, no, you can because there is a language barrier, diba? So just privately message me in messenger. No, you can ask your classmates about my Facebook account. Okay, I will give a special consideration for you. No, okay. Don't hesitate to ask a question. I want you, Miss Odette, to learn, no, to learn in this subject. Okay, so are you there, Miss Odette? Hello?
Sir, laki na siya, sir.
Ay, Lucky? Mr.
Yes,
Sorry.
Ame.
Okay. Okay, you can privately message me, okay?
Okay, sir.
Don't
Sir.
hesitate to ask question
All right, sir.
because I want my student to learn. Okay? Okay, so again, another physical stage of a contrast media is a powder. Okay, usually mga barium sulfate, no? This one. This is a powder. Ako siyang abrihan. Okay, in this bottle, guys, this is a barium sulfate nga contrast media used for a barium enema examination, isa paguram, upper GI series. Okay? So, luckily, na ako'y supply dire. Wait lang. Gusto siya maabrihan. Okay? So, inside this bottle, guys, no, powder ang sulod ani. Okay? The component or inside in this bottle is a powder states of a contrast media. Okay? So another one, a liquid, all iodinated and non-contrast media. Okay, so mga iodinated or water-soluble iodinated contrast media, usually yung appearance niya or physical appearance niya in that type of contrast media, liquid. Okay, so this is for example, no? This is a bottle of iodinated contrast media. So if you open this bottle, guys, okay, you can see a liquid appearance of a contrast media. Usually, always take note, no? Take note that all iodinated or water-soluble iodinated contrast media, now the modes of introduction always is intravenous. Okay? But also, no, not just intravenous only. Also, if ever, okay, later on, no, I will explain to you, diba? Just like I said that in barium enema or esophagogram or any radiologic special examination of the genitourinary system, no, always the type of contrast media being used there is the barium sulfate. But this barium sulfate, there are a lot of contraindication, no? There are some patients that dili ta pwede mo use og barium sulfate. Okay? So the another ano sina? Okay, so pwede ta mo gamit og iodinated contrast media, no, if ever the barium sulfate is contraindicated of that patient, no. So any idea here, no, what is the contraindication of a barium sulfate? Ano may idea? If ever the patient naa siya ay na condition ba, di ta pwede og barium sulfate. So if ever dili ta pwede mo gamit og barium sulfate, okay, diri ta sa iodinated or water soluble or non-ionic contrast media, no, ana dagan kini sa name, no. Okay, so again, no, powder example is the barium sulfate. Barium sulfate, always remember, no, just like this one, barium sulfate ni siya. Yung physical appearance niya or physical state niya is powder. Okay? Barium sulfate is used in genital gastrointestinal tract, no, GIT. Okay? Examination. Just like, or what are the organs that is part of the gastrointestinal tract, gali?
Large
Okay.
intestine.
Hinay lagi kayo. Hinayaw gaulaw. Online bitaw ni. Di ba? Hello?
Esophagus.
Esophagus. Okay, so a radiologic examination used to visualize esophagus, ang term ana is the esophagogram. Okay? So another example of an organ which is part of a gastrointestinal tract is a large intestine. So radiologic examination used to visualize a large intestine. Okay? The term or the name is the barium enema. Okay? Okay, so small intestinal studies. What a gastrointestinal tract organ is being visualized in this type of special procedure ka, no? Small intestinal studies. What do you think? What is the organ? What is the name of the organ?
Small intestine.
Ha? Hinay kayo.
Small intestine, sir.
Okay, small intestine. Okay? So, what radiologic examination used to visualize the distal esophagus, the stomach, and the proximal, no, intestine. What is the name or what is the radiologic examination, no, being performed? If ever again, we will visualize distal esophagus, the stomach, and the proximal small intestine. Baka ni, esophagogram. Esophagus, gini. Barium enema, large intestine. Small intestinal studies. Small bowel, or small intestinal studies, or small bowel series. Small bowel or small intestinal series, they are the same, no? Dagan kini siya name, no? Different names of this kind of examination. But the main or the organs being visualized there is the small intestine. Okay, but can you give me the radiologic examination or the name of the special procedure? Again, no, that is used to visualize distal esophagus, stomach, and proximal small intestine. Ano sa kay answer dira? Kumbaga kung karong siguro ko magpa-exam. Maka-answer kaya mo. What do you think? Actually, the answer is nahatag na nahugay na, no? I give the answer, no, in our previous discussion, no? If ever namati mo, okay? If you are listening carefully in my discussion, the answer is, no, I already give that answer or that examination in my question now, right now. Wala. Okay, so
EGD, sir.
ha? Sa to? Ha? Okay? Kung siguro boys, no, I give you an idea, no? Ay na lang. Okay. Censored siya. So ang term niya murag favorite site niya sa mga laki guro ano, mga single, di ba? Siguro mga old siya nga site sa mga favorite na mga videos sa mga laki dire, no? Starts with letter U. 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 Okay? UGIS, no? Or upper gastrointestinal series, no? Timanin ninyo, upper or UGIS, UGIS, no? Is a radiologic special examination used to visualize distal esophagus, stomach, and sakit to? Stomach and
Proximal,
proximal
small
small
intestine.
intestine. Okay, good, no? Abinawag ba mo na matin dira, guys? Are you still with me? Or nangatulog na mo dira?
Sir,
Hello,
napa.
guys.
Yes, sir.
Napa, sir.
Okay,
Napa, sir.
paningkamot mo dira. Okay, paningkamot po kong explain diri. Maski murag galisod na kong explain og English diri, pero I'll try my best. Aside from that, murag lutang gigay ko ron sakit ang ulo. Kulang sa tulog. Okay? Lack of sleep. Okay? So, kampo dira. Pamatig tarong, no? Paningkamot. Okay, ayog duka-duka dira. Okay? So, all of these special procedures so pag-program barium enema, small intestine, they are used using a contrast media, no? This contrast media, again, this object is in high subject contrast, no? If ever the X-ray will interact again to the contrast media, no, the X-ray will be absorbed or the X-ray will penetrate less. Okay? So, gamit sila tanan og contrast media. Para kaning esophagus, kaning large intestine sa barium enema nga examination, kaning mga small intestine na organs in this examination, okay, will be clearly visualized in a radiographic image, no? Just like this image, guys. Without contrast media, no, we cannot see or we cannot visualize a large intestine, but with a contrast media, we are easily visualize the large intestine, no? The descending colon, the transverse colon, ascending colon. Okay? So if ever there is a pathology here, maybe there is a tumor, okay, the doctor can diagnose. Oh, in the transverse area, there is a large mass. Okay? So the diagnosing patient, diagnosing patient is not our it's not our profession. No? It is the work or it is the responsibility of a radiologist, no? And when we talk about the radiologists, these are the doctors who is trained or is professional in diagnosing an X-ray image, a CT scan image, and MRI image. Okay, so kita, no, radiologic technologists, we are the one performing the examination. Kumbaga, naata sa frontline. Kita ang nasa frontline. Na kumbaga, ang mga doktor, dawat limpyo na sila sa image na gi-perform or gi-provide sa radiologic technologies. And always remember, kumbaga, in a radiology department ba, ang mga bossing na to is kanang mga radiologists. Okay? Mga radiologists. Okay, sila ang, kumbaga, kung sa gusto nila ng mga protocol, no? Examination, or kung sa ilang gustong image nga ihatag sa ila, muna itong sundon. No? Kung gusto sa doktor nga ang barium enema, ang i-visualize or dapat makita niya sa image ang small intestine, small intestine atong i-highlight dire, atong ipakita sa iya. No, dili large intestine. Okay. So silang gahimo og protocol, no, kita ang ga-perform. Okay, sila ang mag-diagnose sa patient. No? If ever ba, no? If ever the patient, no,